also an option. What is the basic difference? I've told you already. Raynaud's phenomena can be primary or secondary. Primary Raynaud's phenomena की cause क्या होती है? Idiopathic, and this can also be called as Raynaud's disease. So primary Raynaud's phenomena is nothing else but Raynaud's disease. But secondary Raynaud's phenomena is associated with, very good, it is associated with connective tissue diseases like SLE, rheumatoid arthritis or scleroderma. ठीक है, that's important. चलो, what is the drug of choice? ये question था. Very good, it is CCBs, that is calcium channel blockers. If those are not an option, go for nitrates as your second answer. ठीक है, lifestyle modification is always advised. Question number 4. A 72-year-old patient with BPH. What is BPH? Benign prostatic hyperplasia. What is hyperplasia? Increase in number of the cells. If the cells will increase in number, definitely the size of prostate will also increase. And what is going in between the prostate? Which part? The prostatic urethra passes. तो अगर prostate की size बढ़ेगी तो क्या हो जाएगा? Prostatic urethra compress हो जाएगा. And if the prostatic urethra will compress, will the patient be able to pass urine? No. That is why a case of BPH will mainly complain of urinary symptoms. So the patient will have urinary retention, there will be urinary incontinence, the patient will have hesitancy, urgency, all of these features. ठीक है, तो उनको सबको मिला के हम क्या बोलते हैं? LUTS. That is rover urinary tract symptoms होंगे patient में. ठीक है, so a patient of BPH underwent transurethral resection of prostate. I hope all of you are quite aware. Usually in a case of BPH, BPH is common in which patients? Males who are more than 50 years of age. इनमें ज्यादा common होता है. That is elderly males में ज्यादा common होता है. Okay, and it is due to action of which hormone on the prostate gland? Testosterone or DHT? DHT. The active. अगर दोनों option में है तो it is the active form of testosterone called as DHT, dihydrotestosterone. ठीक है, क्योंकि testosterone जब convert होता है DHT में तब जाके action होता है, and that is done by enzyme called as 5-alpha reductase. तो first line will definitely be medical management. अगर medical management करोगे तो definitely you will give 5-alpha reductase inhibitors which will decrease the size of prostate. But इसमें time लगेगा या जल्दी हो जाएगा? टाइम लगेगा. अभी पेशेंट में प्रॉब्लम क्या है कि उसको यूरिनरी कंप्लेंट्स है, तो अभी इमीडिएटली रिलीफ मिलेगा क्या? नहीं. तो अगली बार तुम्हारे पास आएगा क्या? तो इसको इमीडिएटली खुश करना है. सर्जन का एक ही मकसद होता है, पेशेंट इमीडिएटली खुश होना चाहिए. ठीक है, मेडिसिन वालों को उल्टा होता है. मेडिसिन वाले बुलाते रहेंगे. सर्जन काटा काटा सूचर कर दिया, खत्म, पेशेंट खुश. ठीक है, कॉम्प्लिकेशन भले ही हो वो बाद में देखा जाए, बट एनी विच वेज दैट इज व्हाट इज द satisfaction that we get usually. ठीक है, तो मेडिकल मैनेजमेंट की अगर मैं बात करूं तो यूजुअली मेन इंपॉर्टेंट प्राइमरी एम क्या है ट्रीटमेंट का? साइज कम करना या यूरिनरी कंप्लेंट्स ठीक करना? यूरिनरी कंप्लेंट्स ठीक करना. इसलिए अगर वो ड्रग ऑफ चॉइस पूछते हैं देन योर आंसर शुड बी tamsulosin. And what is tamsulosin? Selective alpha 1A blocker. अब तुम बोलोगे सर ये आपने फार्मा वाला क्यों? ऐसे ही पढ़नी होती है फार्मा, यही तरीका है फार्मा पढ़ने का. भूलते हो ना, क्यों? क्योंकि तुम्हें ड्रग याद है, तुम्हें ग्रुप नहीं याद. पर याद करो ना, हर बार सर्जरी पढ़ रहे हो ना, करो ना याद ग्रुप फार्मा का. फार्मा ऐसी याद होनी. फार्मा हर जगह मिलेगी तुम्हें, माइक्रो में मिलेगी, डर्मा में मिलेगी, इसमें मेडिसिन में मिलेगी, सर्जरी में मिलेगी, ईएनटी में मिलेगी, ऑफ्था में मिलेगी. हर जगह याद करने की कोशिश करो ये ड्रग कौन सी ग्रुप की थी, इसका साइड इफेक्ट क्या था, मैकेनिज्म ऑफ एक्शन क्या था. then it will become much easier. So drug of choice is definitely a selective alpha 1A blocker called as tamsulosin, or another drug is called as silodosin in the group. Along with that, definitely we will give a 5-alpha reductase inhibitor. And what is that drug? Finasteride, which will help in decreasing the size of prostate. But if medical management fails, then I'll go for the definitive management. And what is that definitive surgery? TURP. What is TURP? Transurethral resection of prostate. So with the help of a laser, you will try to burn the prostate and decrease the size of the prostate. But you are taking the laser via the urethra of this patient. यहाँ से ले जाओगे, ठीक है, ये लेजर अंदर गया और ये लेजर क्या करेगा? बर्न करेगा प्रोस्टेट को. ठीक है, तो in that condition, definitely as the prostate is burning, definitely we need to use a irrigating fluid, some kind of irrigating fluid. ठीक है, तो जो irrigating fluid use होता है, I have told you which is the best irrigating fluid. Very good. Which kind of a glycine? Hypotonic, isotonic या hypertonic? The best fluid will be a isotonic glycine. What do I mean by isotonic? जिसका concentration is exactly equal to that of the plasma, जिसका concentration blood के concentration के equal हो, इसको बोला जाता है isotonic fluid. So it is a isotonic glycine which is generally used for irrigation definitely. ठीक है, that's important. After 1 hour of the surgery, he developed vomiting and altered sensorium. The most probable causes TERP syndrome, also known as water intoxication syndrome. क्यों होता है अब देखो. So for example, this was the urethra of this patient. यहाँ पे हम irrigation, यहाँ पे हम resection कर रहे थे prostate का, and उसके लिए हम क्या डाल रहे थे अंदर, fluid डाल रहे थे. The fluid that was used here was not isotonic glycine. उन्होंने क्या गलती कर दी, they used a low concentration वाला fluid, that is a hypotonic fluid. क्या लिखवाया था. और जिनको लग रहा है कि ये प्रीवियस ईयर क्वेश्चन नहीं है, जाके एफएमजी के क्वेश्चंस एक बार वापस देख लेना, ये प्रीवाईक्यू है एफएमजी एग्जाम का तुम्हारे. ठीक है, तो दैट्स इंपॉर्टेंट. ये कोई नीट पीजे का क्वेश्चन नहीं है, पीवाईक्यू एफएमजी एग्जाम का है. ठीक है, तो इंपॉर्टेंट है. आइदर द हाइपोटोनिक फ्लूइड कैन बी 5% डेक्सट्रोज और इट कैन बी डिस्टिल्ड वाटर. ठीक है, आइदर इट कैन बी अ 5% डेक्सट्रोज और डिस्टिल्ड वाटर. हाइपोटोनिक का मतलब होता है लो कॉन्सेंट्रेशन एज कंपेयर टू प्लाज्मा. तो अब क्या होगा, if the concentration inside the blood vessel is high, if the this is the blood vessel, if the concentration of plasma inside the blood vessel is high, the fluid will try to dilute it and the fluid will go into the blood vessel. अब क्या होगा, ये देखो, जहां कॉन्सेंट्रेशन ज्यादा है उसको डाइल्यूट करने के लिए फ्लूइड क्या करेगा, ज्यादा कॉन्सेंट्रेशन की तरफ भागेगा. यहां ज्यादा कॉन्सेंट्रेशन का है, यूरेथ्रा में या ब्लड वेसल में, ब्लड वेसल में. क्यों, क्योंकि हमने कैसा फ्लूइड यूज करा है, हाइपोटोनिक. तो डेफिनेटली उसके मुकाबले ब्लड वेसल का या प्लाज्मा का कॉन्सेंट्रेशन ज्यादा है, तो पूरा का पूरा फ्लूइड कहां भागेगा, इट विल गो इनसाइड द ब्लड वेसल. अ लॉट ऑफ फ्लूइड, ऑल दिस फ्लूइड, वाटर वगैरह जो भी यूज किया तुमने, वो पूरा का पूरा ब्लड वेसल में हो जाएगा. अब इतना सारा फ्लूइड अगर तुम्हारे ब्लड वेसल में जा रहा है, डेफिनेटली व्हाट इज हैपनिंग, देयर इज डाइल्यूशन ऑफ द प्लाज्मा. एंड अभी इसमें सोडियम है क्या इस फ्लूइड में, नहीं है, बस क्या जा रहा है, वाटर जा रहा है. तो वाटर की लेवल क्या हो रही है ब्लड में, बढ़ रही है, सोडियम की लेवल उतनी है. तो इसमें क्या हो रहा है, डाइल्यूशनल हाइपोनाइट्रेमिया. व्हाट इज हाइपोनाइट्रेमिया, डिक्रीज सीरम सोडियम. इंपॉर्टेंट है, तुम बोलोगे सर सोडियम कहाँ कम हुआ, सोडियम तो नॉर्मल है. ठीक है, सोडियम नॉर्मल है, बट उसके साथ में अगर हम देखेंगे वाटर की लेवल क्या हो गई, बहुत ज्यादा बढ़ गई है. तो दिस इज नॉट अ एक्चुअल हाइपोनाइट्रेमिया, दिस इज अ रिलेटिव हाइपोनाइट्रेमिया, डाइल्यूशनल हाइपोनाइट्रेमिया. अगर हम दोनों को कंपेयर करेंगे तो वाटर बहुत ज्यादा है और सोडियम उतना ही है, तो देयरफॉर दिस इज द केस ऑफ डाइल्यूशनल हाइपोनाइट्रेमिया. एंड अगर सोडियम की लेवल कम हो जाती है ब्लड में, देयरफॉर द पेशेंट सफर्स फ्रॉम altered sensorium. The patient can even have seizures. The patient can also have nausea and vomiting. So these are the usual complaints of the patient. And if these are the complaints after a TERP surgery, definitely we need to think in terms of water intoxication syndrome, also called as TERP syndrome. Okay, so here your diagnosis is definitely TERP. What is done for management? कैसे मैनेज करोगे, डाइल्यूशन हो चुका है ना, बहुत ज्यादा फ्लूइड गया है, तो और फ्लूइड दोगे क्या पेशेंट में, तुम नहीं दोगे. तो फर्स्ट लाइन मैनेजमेंट इज फ्लूइड रेस्ट्रिक्शन. फर्स्ट लाइन मैनेजमेंट इज डेफिनेटली फ्लूइड रेस्ट्रिक्शन. इसके साथ साथ डेफिनेटली अगर जरूरत पड़ती है, डायूरेटिक्स कभी कभी देते हो, बट अगर सोडियम की लेवल बहुत कम हो जाती है, सोडियम की लेवल बहुत कम हो जाती है, तो तुम्हें सोडियम देना पड़ेगा. एंड दैट इज डन बाय गिविंग 3% हाइपरटोनिक सलाइन, जिसमें सोडियम की लेवल ज्यादा होगी. तो दिस इज नॉट ऑलवेज रिक्वायर्ड, बट इफ फ्लूइड रेस्ट्रिक्शन नॉट हेल्प्स, देन डेफिनेटली तुम्हें आगे जाके क्या देना पड़ेगा, कॉन्सेंट्रेटेड सलाइन देना पड़ेगा, दैट इज द 3% हाइपरटोनिक सलाइन भी देना पड़ सकता है. एंड डेफिनेटली वी कैन ऑल्सो यूज डायूरेटिक्स टू रिमूव ऑल दैट एक्सेस अमाउंट ऑफ फ्लूइड फ्रॉम द बॉडी. ठीक है, कोई हाँ बोलो. पोस्ट्यूरल हाइपोटेंशन नहीं, याद रख लो, अगर डेफिनेटली टैम्सुलोसिन जो होता है ना, वो टैम्सुलोसिन कैन बी गिवन इन एनी केस ऑफ हाइपोटेंशन बिकॉज इट इज वेरी सिलेक्टिव ऑन ओनली ऑन द अल्फा 1A रिसेप्टर्स. जो तुम प्राजोसिन बोल रहे हो, द ड्रग्स लाइक प्राजोसिन, अल्फ्यूजोसिन, टेराजोसिन, these are the drugs which are alpha 1 blockers. That means they will act on alpha 1A as well as alpha 1B. Problem is when they block the alpha 1A receptors, definitely the patient prostatic urethra के जो स्मूथ मसल्स है they will get relaxed and the urine outflow will increase. Problem is when they block these alpha 1b receptors, these are located on the blood vessels. Now what will happen? The smooth muscles of these blood vessels will relax and therefore the vessels will undergo dilatation. And vessels अचानक dilate हो जाएगी तो blood pressure अचानक से fall हो जाता है. That causes posterior या orthostatic hypotension as a side effect in cases of prazosin. Therefore, अगर patient में कोई hypertension की history नहीं है, that is the reason why we do not use prazosin as the first line drug. ठीक है? If a person is normotensive, उसमें कोई hypertension नहीं है, तो उसमें tamsulosin use करो, because tamsulosin will only act on these prostatic urethra. But अगर patient में ऐसा दिया है कि a patient is suffering from BPH, along with that he is hypertensive, तो उसमें तो blood pressure भी कम करना है. So in this case, definitely the drug of choice becomes prazosin. In this case, the drug of choice becomes prazosin. ठीक है? चलो. Moving further now, this is what is a TERP. I've already told you TERP is, you know, definitely nowadays we do not use this resector or a microdebrider. Nowadays we only use a laser to decrease the size of the prostate. ठीक है? Definitely. What is this? Anybody? Shabash. It is a case of osteoblastic or osteoclastic. It is a case of osteoblastic or bone forming metastasis. And the most common cause of osteoblastic metastasis is Shabash. The most common cause of osteoblastic metastasis is prostate cancer. Okay? And that is the reason why if an elderly patient comes to you with urinary symptoms along with low backache, then your diagnosis should be metastatic prostate cancer. ठीक है? अगर बस low backache है तो multiple myeloma हो सकता है, but अगर low backache along with urinary symptoms है तो definitely metastatic prostate cancer के बारे में सोचना है. This was a previous year question as well. ठीक है? Which cancer causes osteoblastic metastasis? Most common cause is prostate. Second most common cause is breast cancer. But breast commonly causes osteolytic. ये तो पता है ना? Breast commonly causes osteolytic, but it can cause 10 to 15% can cause osteoblastic. But prostate में ज्यादा common कौन सा है? Osteoblastic ज्यादा common. चलो. Talking about urethral ruptures, I've told you यहाँ पे एक option था rupture of urethra. Problem is अगर urethral rupture होता है तो either it can be anterior urethral rupture या posterior. ये क्यों बता रहा हूँ? क्योंकि ये सरकारी क्वेश्चन हो चुका है तुम्हारा एग्जाम. एक तो रेडियो या तो सर्जरी. Urethral rupture is a सरकारी question of your exam. Please do it properly. ठीक है? Now there are two parts of your urethra, anterior और posterior urethra. Anterior urethra के दो हिस्से कौन से? जल्दी से. It is definitely the penile urethra first, and second is the perineal, also known as bulbar urethra. Whereas posterior urethra के दो हिस्से कौन से? One is called as membranous urethra, and the next is called as prostatic urethra. Now please tell me, overall most common site of urethral rupture. More common is definitely anterior urethral rupture, and in anterior also the more common is perineal urethral rupture. तो अगर वो overall पूछते हैं, okay, most common site for urethral rupture, answer should be perineal or bulbar urethral rupture. Most common site I've already told you. Here it is perineal, and in posterior one it is membranous. Most common cause जल्दी से. In cases of anterior urethral rupture, it is a perineal trauma. Which kind of perineal trauma I've already told you? A bicycle accident or a loose manhole cover injury. Whereas posterior urethral rupture it is a pelvic trauma because the posterior urethra is present in the pelvic cavity. So it can be a pelvic fracture, usually in a road traffic accident. Triad, मैंने बताया था, दो features similar है. क्या क्या? First of all, the patient, will he be able to pass urine? No. That will cause retention of urine. And apart from retention of urine or inability to pass urine, second is blood at the tip of external urethral meatus. These are the two common features in both the triads. The differentiating feature of both the triads, in anterior urethral rupture, there will be a hematoma formation in the perineum. So therefore here there will be a perineal hematoma. Whereas in cases of posterior urethral rupture, there will be a hematoma formation in the pelvis. So here there will be a pelvic hematoma. Investigation of choice for both of them is RGU, that is retrograde urethrogram. Whereas treatment of choice, if you have a skilled surgeon with you, then you can try a Foley's catheter. But if you do not have any skilled surgeon, better is always a suprapubic catheterization. So a lot of people were like, sir, injured है तो भी डालेंगे क्या? अगर तुम्हारे पास कोई SR वगैरह कोई skilled surgeon available है तो ही Foley's try करा जाता है. Otherwise you directly go for SPC. ठीक है? So that's the important thing. Moving further, question number 5 now. It says a 55-year-old patient presents with dysphagia. What is dysphagia? Difficulty in swallowing. He's having difficulty in swallowing for both solids as well as liquids. The barium swallow was done, which shows the following findings. Preferred treatment is. What is the following finding, anybody? क्या दिख रहा है ये? शाबाश शाबाश. ठीक है, यहाँ पे क्या दिख रहा है? There is some mass inside the esophagus due to which in that area we are not able to see the contrast of the barium sulfate. ठीक है, तो इसीलिए this is what is called as, either this is called as a filling defect, okay, it is known as the filling defect, या कौन से टाइप का appearance दिख रहा है ये? Rat tail appearance. Okay, so filling defect or a rat tail appearance, I have already told you, it is usually seen in a case of esophageal carcinoma or esophageal cancer. So definitely this is a case of esophageal cancer. What is the treatment now? Preferred treatment is. So we know which part of the esophagus is having this tumor. It is usually seen in the middle 1/3. As we know, esophageal cancer can be of two types. Either it can be a squamous cell carcinoma or adenocarcinoma. More common is squamous cell carcinoma. Most common site for squamous cell carcinoma is middle 1/3. Definitely. For adenocarcinoma it is lower 1/3. Important. Okay, so please remember that. Risk factor: smoking and alcohol are common for both, but important motility disorder, which is the risk factor for squamous cell carcinoma of esophagus. Shabash. It is achalasia cardia. And which diverticulum? Zenker's diverticulum. तो याद रखना, बाकी तुम्हें कोई पूछे ना पूछे, ये वाले इंपॉर्टेंट हो जाते हैं. ठीक है, स्मोकिंग अल्कोहल उनको सबको पता है, तुम्हें पता है करके. ठीक है, नहीं भी पता तो कम स्मोकिंग और अल्कोहल का मारोगे, ये अलग है ना, तो ये याद रखने की जरूरत है, ये हाईलाइटेड होने चाहिए तुम्हारे टेबल में. ठीक है, नेक्स्ट इज एडिनोकार्सिनोमा के लिए इंपॉर्टेंट रिस्क फैक्टर GERD, definitely gastroesophageal reflux disease, which can further progress to Barrett's esophagus, definitely. And which connective tissue disorder? Shabash. It is scleroderma or systemic sclerosis. ठीक है, no issues with this. ये याद होने चाहिए तुम्हें. Important is, which is the most common site for esophageal, which is the most common type of esophageal cancer in the Western Hemisphere? Adenocarcinoma. Very good. Because in Western Hemisphere there are high chances of GERD or Barrett's esophagus due to the sedentary lifestyle and the eating habits. That is the reason they have more chances of lower 1/3 cancer, that is adenocarcinoma. No issues with this. And I've told you, for management of a esophageal cancer, definitely the treatment is removal of the esophagus, and that is what is called as esophagectomy. Proximal margin is 10 centimeter and distal margin is 5 centimeter. Okay. Now, if the cancer is in the middle 1/3, then definitely the surgery is called as Ivor-Lewis operation, which is the most commonly performed surgery. But if it's in the lower 1/3, very good, it is called as Oringer surgery. Oringer is also known as transhiatal esophagectomy. Whereas if it is in the upper 1/3, McKeown's, very good. If it is in the upper 1/3, it is called as the McKeown's esophagectomy. Okay? So these are the three names, you need to remember them properly. So we know majority of the cases of esophageal cancer are in the middle 1/3. Any which ways, यहाँ भी barium swallow में दिख रहा है कि the filling defect is in the middle part of the esophagus. So definitely the surgery is called as Ivor-Lewis operation. Any which ways, I did not give you any other operation also. So no need to get confused. It was Ivor-Lewis operation straight away. Okay? That is important. Nielsen's fundoplication is the surgery of choice for which condition? It is the surgery of choice for GERD, that is gastroesophageal reflux disease. Surgery of choice. Treatment of choice for GERD will be PPIs, that is proton pump inhibitors. I have told you, for GERD, the treatment of choice is never a surgery. It is always a medical management with PPIs, because 90% of the cases of GERD improve only with PPIs. Therefore, treatment of choice for GERD is always PPI. Surgery of choice अगर पूछेंगे तो तुम्हारा आंसर होना चाहिए Nielsen's fundoplication. ठीक है? Heller's cardiomyotomy is the treatment of choice for achalasia cardia. ठीक है? So what is this appearance on barium swallow? Shabash. On this barium swallow, you are able to see sharp margins and a gradual narrowing. Therefore, it is a case of achalasia cardia. Please remember, it is a case of achalasia cardia. And definitely here we are able to see the bird beak appearance. I've told you, you never call this rat tail. Interchangeable terms nahi hote dono. Rat tail mein there are shaggy, irregular margins and there is a shouldering effect. But in this condition, you will see a gradual narrowing and there will be a sharp margin, regular margin which will be seen. Okay? So bird beak or pencil tip bol sakte ho isko, but never a rat tail. Okay, so this is a bird beak or a pencil tip appearance definitely. What is the investigation of choice for achalasia cardia? अरे सॉरी, ये बताओ मुझे अकेलेसिया कार्डिया में होता क्या है? सरकारी क्वेश्चन है तुम्हारे एग्जाम का. द लो शाबाश 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 वेरी गुड. हाँ, अब सुनो. The lower esophageal sphincter is in constant spasm. Why it is in constant spasm? Because the lower esophageal sphincter is not able to relax. As it is not able to relax, definitely the pressure at the lower esophageal sphincter will be very high. Normally lower esophageal sphincter pressure कितना होता है? 8 to 25 millimeters of mercury. But here the pressure will be more than 25 millimeters of mercury. 25 till 100 usually. When the pressure is more than equal to 180, shabash, it is called as nutcracker esophagus. And when the pressure is more than 300 millimeters of mercury, then definitely it is called as DES, what is known as distal esophageal spasm or diffuse esophageal spasm. Distal is the new name for diffuse esophageal spasm. Okay, in Bailey it was given. No issues with this anybody? यहाँ पे जो बेरियम्स वालों को रहोगे कौन सा अपीयरेंस दिखेगा? Here you will see a corkscrew or also called as shabash rosary bead appearance. ठीक है. Now important is in achalasia cardia, what is the cause usually? The lower esophageal sphincter is high because it is not able to relax. क्यों relax नहीं हो पा रहा? Because there is loss of there is loss of ganglionic cells. In which plexus? That was the question. In Auerbach's or the myenteric plexus. It is not the Meissner's plexus, so don't get confused. Okay? So it is loss of ganglionic cell in the Auerbach's or the myenteric plexus of the GIT. Okay? Or there is deficiency of which neurotransmitters? Nitric oxide, or second is VIP, vasoactive intestinal peptide. No issues with this anybody? These are the usual causes of achalasia cardia. It is a motility disorder. Here the patient will come to you with dysphagia, halitosis and regurgitation. Important is here the patient will have dysphagia, but that will be more to liquids or solids. So the patient will have dysphagia. So definitely the dysphagia in case of achalasia cardia is more to liquids as compared to solids. Whereas it is vice versa in a case of esophageal cancer. Okay? So that's important to be remembered. Investigation of choice abhi jaldi se. To see the pressure ना, pressure बढ़ा हुआ यही देखना है ना तुम्हें. क्या करते हो pressure देखने के लिए? Pressure is called as mano, measuring is called as metry. So it is esophageal manometry. Investigation of choice is the esophageal manometry. Treatment of choice I've already told you, it is Heller's cardiomyotomy. Complication of Heller's cardiomyotomy anybody? Shabash, bolo जोर से फिर. Good. Okay. So complication of Heller's cardiomyotomy is good. And that is the reason why to prevent this, we will always go for a floppy niscence fundoplication. We will always go for a floppy niscence fundoplication in the patient as well. ठीक है? Along with Heller's. ठीक है? तो अगर एक ऑप्शन बोल रहा है Heller's cardiomyotomy, दूसरा ऑप्शन बोल रहा है Heller's cardiomyotomy plus floppy niscence fundoplication. Better answer is this one. Heller's cardiomyotomy plus floppy niscence fundoplication, because due to Heller's cardiomyotomy, there will be very high chances of GERD in the patient. To prevent that, better in the same surgery, go for a floppy niscence as well. ठीक है? याद रखनी ये बात. Moving further, this is what is a niscence fundoplication. Partial wrap or a complete wrap of stomach around the esophagus. Complete 360-degree wrap of stomach or the fundus of the stomach around the esophagus, which will not let the lower esophageal sphincter relax too frequently. And that is how it will prevent GERD in the patient. Moving further. Question number 6 now. A 75-year-old female presents with complaints of fever, generalized weakness and anterior neck swelling since 3 years. But it is rapidly progressing since the past 3 to 4 months. Pain over the swelling is also noticed, and hoarseness of voice is also there. She gives history of weight loss also, but no history of cancer in the family as such. Most probable diagnosis is. तो अब कीवर्ड्स क्या क्या थे तुम बताओ इस बार. चलो, रैपिडली प्रोग्रेसिंग था, पेन ओवर द स्वेलिंग था, वेरी गुड, एज ऑफ द पेशेंट था, यूजुअली 6th to 7th decade of life, एंड होर्सनेस ऑफ वॉइस था, दैट इज सजेस्टिव ऑफ लोकली इन्वेजिव कैंसर. ये तुम्हारे कीवर्ड्स. अब तुम्हें उठाना आ गया कीवर्ड्स, ठीक है. दैट इज हाउ वी नो कि अच्छा डायग्नोसिस क्या बनता है अभी, ठीक है. दोज हु आर नॉट अवेयर स्टिल, ये देखो, ये होता है कीवर्ड, द वंस दैट आई हैव हाइलाइटेड. These are the only symptoms seen in a case of anaplastic thyroid cancer, nothing else. Important is anaplastic thyroid cancer is the least common variety of cancer, definitely. It is the least common variety of thyroid cancer, and it will have the worst prognosis. It is the one which will have worst prognosis. Anaplasia का मतलब क्या होता है पैथो से जल्दी से? Lack of differentiation. That means खिचड़ी. You are not able to make out any cell properly. That is what is lack of differentiation or anaplasia. And therefore, any type of anaplastic cancer, not only in thyroid, will have the worst prognosis. ठीक है. तो अगर और कहीं समझ नहीं आ रहा, worst prognosis है, तो usually it can be anaplastic. ठीक है. That's the important. Usually anaplastic cancer, we know it is more common in the 6th to 7th decade of life usually. Here also the most common symptom, like any other thyroid cancer, will be a neck swelling in the patient, usually a midline neck swelling. But what will be the other features? The patient will have rapidly progressive neck swelling. Other thyroid cancers are usually slow growing, but anaplastic is rapidly growing. Next, the patient will have pain over the swelling, which is not a feature of any other thyroid cancer. In all other thyroid cancer, there is a painless neck swelling. Pain over swelling is a feature of anaplastic. Important is, definitely all other thyroid cancers can also spread to the other structures, but more commonly it is the anaplastic thyroid carcinoma. As it is rapidly growing, it spreads to all the other adjacent structures. आसपास फैल जाएगा. And one of the structures which is there in the vicinity of thyroid gland is known as RLN, recurrent laryngeal nerve. And that is the reason why there will be involvement of recurrent laryngeal nerve causing hoarseness of voice in the patient. And सबसे ज्यादा weight loss in any cancer of thyroid is seen with anaplastic thyroid carcinoma itself. ठीक है. So these are the usual features. And जब तुम palpate करोगे swelling, एक और keyword दिया था मैंने, क्या बोला था? Very good. All other thyroid cancers will feel soft, but one thyroid cancer which will feel hard like a stone or a wood is what is the anaplastic thyroid cancer. These are the keywords to make a diagnosis of anaplastic thyroid carcinoma. Anaplastic thyroid carcinoma में, if the cancer, treatment of choice क्या है? If the cancer, I'll talk about other thyroid cancers. First, I'm done with anaplastic. If the cancer is within the gland, that means haven't spread to any other structure, I will go for a total thyroidectomy. Along with that, the level 6 lymph nodes have to be removed. That is called a central neck dissection. Along with that, all the other lymph nodes are also removed. That is called as modified radical neck dissection. But if the tumor spreads outside the gland, definitely we know now the patient cannot be saved. Here we will only go for a palliative care. ठीक है? याद रखना ये बात. That is important. No issues till anybody. Now if I talk about thyroid tumors, guys, which is the most common benign thyroid tumor? Follicular adenoma, definitely. But if I talk about malignancies or malignant tumors, definitely there can be some metastasis from other primary cancers. That will be called as secondaries or metastasis. But if the cancer arises from the thyroid gland itself, this will be called as a primary thyroid cancer. If I talk about primary thyroid cancer, if it arises from the follicular cells, then it can be of two types. एक तो वो differentiated हो सकता है, मतलब you are able to see every cell properly. Then it will be either a follicular thyroid cancer or papillary thyroid cancer. And तीसरा जो लिखवा था वो Hurther cell cancer था. And if it is undifferentiated, मतलब खिचड़ी है, follicular cells ही arise हो रहा है, but इस बार खिचड़ी दिख रही है पूरी, then it is a case of anaplastic thyroid cancer. ठीक है? If I talk about if the cancer arises from the parafollicular C cell, then the cancer is known as medullary carcinoma of thyroid. And if the cancer arises from the lymphoid cells of thyroid gland, then it is called as a thyroid lymphoma. In thyroid lymphoma, I've told you, it is also common in which patients? Elderly, around 6 to 7 decade of life. Which is the most common lymphoma in any other organ? Non-Hodgkin's lymphoma. Non-Hodgkin's में most common subtype? Shabash. It is DL BCL. That was a previous year question. Diffuse large B cell lymphoma is the most common type of lymphoma in any other organ except the lymph nodes. Lymph nodes में तो Hodgkin ही होता है. Non-Hodgkin सबसे common type पूछा जाता है, तो answer is DLBCL. That has to be remembered properly. ठीक है? And lymphoma में, along with neck swelling, along with the pressure symptoms that the thyroid cancer can cause, it will also lead to a characteristic symptoms. What are those symptoms called as? Shabash. Those are known as category B symptoms. कौन से disease जैसे symptoms होते हैं? TB like symptoms, low grade evening rising fever, weight loss, anorexia, and drenching night sweats. Okay, these are the usual features of a lymphoma. याद रखने की जरूरत है ये. ठीक है, तो ये सर्जरी नहीं है, ये इंटीग्रेशन चलता है. इसी तरीके से अब तुम्हें रिविजन्स में स्टार्ट करना होगा. तुम सर्जरी पढ़ रहे हो, उसका मतलब ये नहीं कि